Hi, welcome back to another episode of Covering Your Health, presented by IEHP and hosted by me, Evelyn Erives. I'm so happy to see you here and that you have joined us for a very special episode. I say that every time, but really, I feel that way. Every episode is so special. There's so much to learn from some of our great partners in the community and people that are doing good. And I really feel like this is going to be a good one for you to stick around for. Today, we are diving into all things brain health with a very special guest and friend of mine, Deborah Levy. She's the executive director of the Alzheimer's Association. We're going to dive into ways to keep your brain happy and healthy and the early signs and symptoms of Alzheimer's and dementia. And that really bittersweet fun that we recently had participating in the annual Walk to End Alzheimer's. We did that on November 8th in Huntington Beach. It was bittersweet. It was beautiful. It was heartbreaking, and it was something so special. So I can't wait to talk to you all about that. Every 67 seconds, someone in America develops Alzheimer's. And today, more than 7 million are living with the disease. By 2050, that number is expected to rise to nearly 13 million, according to the Alzheimer's Association. Despite these alarming statistics, we are on a path to finding a cure thanks to organizations like the Alzheimer's Association and platforms like this to serve as a way to educate really the public and share the importance about keeping active, what ways we can support our loved ones who are diagnosed, and resources available to our amazing caregiver community. So let's get started, shall we? Let's welcome Deborah.
Welcome to Covering Your Health, a wellness podcast dedicated to covering all areas of living a healthy and happy lifestyle. From healthy hearts to understanding health plans and everything in between, each episode will provide you with a better understanding of managing your health, preventative care, and staying on the right path for your family's wellness journey. The Covering Your Health podcast is presented by IEHP. Now, your host, Evelyn Erives.
Welcome, Deborah. How are you?
I'm great. It's so lovely to see you. I'm not sure if your listeners know that you emceed one of our big events.
I know I kind of mentioned a little bit about it, but we do need to talk about that because you and I actually have known each other a long time, even before the walk. So we need to chat about that for sure. I'm very excited that I was able to get you on here, especially since that event just took place a few weeks ago, and we are fresh off of the walk and the excitement of that day. But before we get into that, I want to talk about you. You have a story. You tell everyone about yourself. Let them know who you are and how did you get into this line of work? Did that start when you were very young? Did you say, you know what, nonprofit work, that's where I want to be?
No, just like you, I was a television news anchor when I first graduated from UCLA. I started in television broadcast news and worked in Missouri and then Florida and then Nevada, and then had an incredible opportunity to run a nonprofit that was very near and dear to my heart, which was Ronald McDonald House Charities. And so I left television and said I could do anything for a year. And, more than almost 2 decades later, I'm now still in nonprofit leadership. Currently, right now, my role is I'm with the Alzheimer's Association, and I'm the executive director for the Orange County chapter. And, it is a very deeply personal mission, like many of your listeners and viewers. I've seen a lot of people that I love navigate the challenges of Alzheimer's. And kind of what I do in my role now is I'm leading our chapter's efforts when it comes to advocacy work, care and support to individuals who are dealing with dementia, our community education, our community outreach. I work with an incredible team to connect people impacted by Alzheimer's or another form of dementia with the resources that they need. And, we're always pushing forward for research and prevention.
Yeah, I love that. So, okay, can you tell me, just because I don't think I know this answer, how many nonprofits have you worked with? Because you've done some really incredible work in those 2 decades.
Yeah. So in terms of like working for the nonprofits,
Yeah.
space.
Oh, I know you've done a lot more beside the war. You
Um,
volunteer everywhere.
Ronald McDonald House Charities, and then United Cerebral Palsy of Orange County. I was their president CEO. Um, they have since folded with Children's Hospital of Orange County and Rady Children's out of San
Oh.
Diego. Then you and I met when I was with the Leukemia and Lymphoma Society. I'm
Hmm.
also a blood cancer survivor, and so that, cause was very near and dear to my heart. And then during COVID, I moved over to the Alzheimer's Association. I've been here for almost 5 years, and I absolutely love it.
Oh, and you've got a great team there too. I
Yeah,
have to compliment you. Everybody that I got to meet and like just they seem so happy to be doing what they're doing.
they
And that
are
says a
there.
lot.
Yeah, a very small but mighty team. I mean, we're really a volunteer led organization.
Hmm.
So very small staff. We're really led by volunteers from like everything from our advocates who are going to Sacramento and to Washington, D.C., to, our community educators who are teaching about brain health, out in the community. Our
Mm.
support groups, they're run by, volunteer support group facilitators.
Yeah,
It's really an incredible organization.
it really is. That's fantastic. I love volunteer-led organizations. I think that's my where my heart is too, because
Mhm.
um um when I fell in love with volunteering, it's one of those things where you're like, oh, I don't know why does everybody doesn't do this. Like I don't understand because once you get in, you are in and you really feel empowered to help. And that's really very cool.
Yeah, so now do we have you with the Alzheimer's
You
Association?
got me,
Came
girl. You got me.
in.
I already told Cindy, and I told my husband that day, I was like, I want to do this again. That was super fun. That was really, really, really cool. Everybody was just so great. Oh, it was so nice. Well, there are many chapters of the Alzheimer's
Mhm.
Association across the country. Can you tell me a little bit about the work that the association does?
Yeah, so I'm going to talk a little bit about how we lead, and then
Sure.
I'll go into like kind of what we do.
Hmm.
But how we lead, we're driven, by a single urgent purpose to end Alzheimer's and all other dementia, period, exclamation point. We're pursuing this mission with determination, clearly with heart. We're accelerating research globally. We want to advance early detection, and we truly want to empower individuals and families to reduce their risk and protect their brain health. So
Yes.
we're partnering with healthcare systems, with public health agencies, with community organizations to ensure, that families are receiving the guidance and resources and the compassionate care, that they deserve. And so what we're delivering in communities across the country, because we're a national organization and we literally are in every single community from coast to coast.
Hmm.
um, we're providing through our local chapters a lifeline of support,
Yeah.
whether it's our support groups for individuals who've been diagnosed with the disease or their care partners. We do caregiver education, we do community workshops. And I think the biggest thing that I want your listeners and viewers to note is that we have a 24/7 helpline that really can answer calls whenever somebody needs help or hope or just simply an ear. And that number is 800-272-3900.
Beautiful. Yes, we gave that number out a lot. And when I was thinking about it at the walk, I was like, wow, that is so cool because when maybe someone in your family is diagnosed, you feel helpless.
Mhm.
And I think you may have seen some signs or symptoms early, but you're still not in that place to go, well, now what do we do? So that's so wonderful that the organization actually offers that kind of 24 hours a day help. Very, very
Yeah.
cool.
And we can answer calls in over 200 different languages. So I think
Oh,
that
wow.
that's also, really important to be able to meet people in a way that they can communicate that where they feel most comfortable communicating.
Right. Right.
So
Like
really
they don't
important.
feel like they're not going to be understood in
Mhm,
no matter where they're at. That's
mhm.
beautiful. In the show intro, I kind of mentioned this stat, which is, pretty staggering. Someone is diagnosed with Alzheimer's every 67 seconds. And that is very, very alarming. There's so much work being done to educate the community about this disease. What tips does the Alzheimer's Association really have to detect those early signs of Alzheimer's, dementia, and so on? And how can our listeners get involved in supporting?
Okay, well, I think that's really important because one of the greatest gifts I think that we're giving to ourselves and the people we love is awareness. So, truly knowing those 10 early warning signs of Alzheimer's and dementia, really important. It is not just memory loss, it is not,
Mm,
normal aging. It can be struggling to plan or solve problems. You're losing track of dates or places. You're noticing changes in mood or judgment or personality that may feel out of character. So, if you're
mm,
observing any of those signs in yourself or somebody close to you, don't ignore them. We're really urging people to get checked because early diagnosis really does change everything. It does open the door to some treatment options. There are now finally two FDA approved
wow.
medications that can slow the progression of Alzheimer's disease. And dementia is an umbrella term, and
Right.
Alzheimer's is the most common form of dementia. And right now, the only FDA approved medications currently on the market are for Alzheimer's disease. But you want to get an early diagnosis. And what clinical trials could be open to you,
Hmm.
treatment
Hmm.
options, support, finding resources. And in my opinion, it's having more meaningful moments, together with your family.
Yes.
That's
Yes.
really important.
Oh, yes, for sure. So you talked about caregivers. What are some questions that one should ask their provider if they suspect maybe someone they love or even themselves may have an early onset of Alzheimer's?
So I think if you're noticing some cognitive changes in yourself or somebody that you love, you do want to understand what's happening, right?
Hmm.
So you're going to want to ask, your physician, what could be causing these cognitive changes that I'm noticing? Are these symptoms consistent with normal aging, or do they suggest something more serious? What
Right,
other
right.
medical conditions could this memory loss look like? Maybe it's a vitamin deficiency or thyroid or sleep disorders. Um, Evaluation and testing. So, what tests will your physician use to evaluate memory and thinking?
Mm.
There's now blood work that can be done, or PET
Oh,
scan
interesting.
imaging,
I didn't know that. Okay,
a
that's good.
neuropsychological evaluation. So, what kinds of tests or evaluations will they use? Do they need to see a specialist, a neurologist or a geriatrician? And then wanting to understand the diagnosis and having clarity about that. What type of dementia could this be? Remember, I was mentioning that dementia is an umbrella term, and
Mm.
there's Lewy body dementia, there's frontal temporal lobe dementia, there's vascular dementia, there's Alzheimer's disease. How will these changes be monitored over time? You want to ask about treatment options.
Yeah,
Uh,
yeah.
Also, planning and support, right? What should I be doing now to plan for the future? Are there resources available to help? Clinical trials that could be available? And then, I would also just mention that the Alzheimer's Association is there for any of these questions as well through,
Nice.
our 800 number. So if you forget to ask a question when you're at that doctor's visit,
Hmm.
you could, contact the association. And our website as well is chock full of information. It is an award-winning website, so it's alz.org. So that's another place.
Fantastic. So we talk about your provider, but what about your own circle of support, your family? How can someone start that conversation within their own circle? Because I feel like sometimes there's a stigma, right? If this is happening and you don't know if for sure it's maybe it is you. How do you
Mhm.
start that conversation with your own family?
Right. It really isn't a conversation people want to have.
No,
Talking to a
no,
loved one about memory loss, especially if you're noticing it in someone else, you
someone
may be
else.
hesitant to say something. The association released a survey a few years ago that revealed like nearly 9 in 10 Americans say they would want others to tell them if they were showing signs of memory loss or thinking problems.
Right.
However, nearly 3 in 4 Americans say that talking to a close friend or family member about memory loss or their thinking problems would be very challenging for
Right.
them. Um, we do have resources available on our website about having these conversations, and how to frame your observations in a very caring way. You might say, I value what matters to you, and I want to make sure, we can get ahead of anything that we can. You're not alone in this. We're going to find answers. So all we have that on our website to be able to have those very caring conversations.
Yes, I love that on your award-winning website.
Yeah.
No, that's fantastic. What words of encouragement do you have for those who are diagnosed now? I know you've worked with many, many people through the organization. What kind of words of encouragement could you offer for them or for a caregiver?
I would say a diagnosis is not the end of your story. It is a starting place for support and planning and connection, and use the resources available. We have peer groups for individuals who've been diagnosed across the country to connect with one another.
Mm,
We have online communities, there's mental health support. We're here to help. And from a caregiver perspective, your role is incredibly challenging. You are courageous. You are deeply impactful. It is okay to ask for help. I would say for the caregiver in particular, that
mhm.
it's super important to take care of yourself. You want to eat, you want to sleep, you want to exercise, you want to take breaks, you want to watch for your stress because your well being also matters.
I love that. Um, are there activities that you can do to strengthen your brain? I mean, I feel like you see on social media now all the time. Maybe it's just my algorithm. But there are so many like, okay, these are great ways to help with your brain development and as you're aging. And here's what you can do to kind of maybe keep these kinds of dementia away. I mean, I know that ultimately things are going to happen if they're going to happen, but there are ways to strengthen your brain, right? Are there any tips that you can offer?
Yeah, 100%. Well, first of all, in July of this year, the Alzheimer's Association published the results of a study called the US Pointer Study,
Mhm.
and folks can look it up. And for the first time, it truly shows that there are things we can do to reduce our risk of cognitive decline.
Okay.
The other thing that's really important is I think sometimes we think of this as an older person's disease, but the amyloid plaque and the tau tangles that are hallmark signs of Alzheimer's start happening decades before,
Oh,
we're showing
wow.
signs of anything. And so we definitely want to promote those 10 healthy habits. That's what we call them. Research suggests that it may, lower the risk of cognitive decline, and this US Pointer study is really showing that it does indeed do that. So that includes things that we know. I mean, Evelyn, I could give you a quiz and you probably would guess all 10. Um, but staying physically active,
Hmm.
eating a balanced diet, challenging your mind, protecting your head because traumatic brain injury, can
Yes.
lead to
Yes.
forms of dementia, managing, your blood pressure and diabetes, quitting smoking, sleep, and then staying socially engaged. Those are kind of those top 10 healthy habits that can reduce somebody's risk. We also, and I haven't played around on it yet, so this is hot off the presses, but um, we have a new evidence-based uh, steps that
Hmm.
we can take. It's on our website called the Brain Health Habit Builder, and people can assess their current habits and build like a personalized brain health plan.
Oh, that's cool.
I haven't tried it yet, but I know it's on our website, and we just got notification that it's been launched.
Yeah. Yeah. I love that. Oh, that's very neat. I'm going to check that out. I know I've known you. I know you have a family and you are very, very busy. How do you do it? How do you keep everything balanced on a
Well,
personal
I
level for
love that
you.
you're even giving me credit for, okay. Yeah, I don't think that I have it all going on, but I will say that I'm definitely, as a cancer survivor, I think
Yes.
that that was a wake up call to me and my health, and like nobody's going to take care of my health like I'm going to take care of my
Mm-hmm.
health.
Mm-hmm.
Um, so like this morning I now get up at like 5:30 and I walk those 10,000 steps, every day. Today it was 47 degrees, when I woke up, and I did not want to go out there, but
Oh
I
no.
put on like 3 or 4 layers and my hat and my mittens, and I did go out and I got my 10,000 steps this morning.
Oh,
Um,
great.
I love learning, new things. I play Wordle every night before I go to bed. It's not that hard for like those people who do Sudoku and other things. It's really not very hard, but I feel good about myself that I do it.
Yes.
Social time, with my friends and my family is really important. I journal as well just to
Mm-hmm.
help, with my mental health. So those are just some of the habits. And now I've started strength training as well as I get into kind of that latter part of my life.
They say that's big. You got to use weights.
You got to use
Everyone's
weight,
telling me that right now.
like heavy weights.
Yes.
So I'm trying. It's not something I love to do, but
Hmm.
I know that that's going to help me later on in life. So
Yes. No, that's great. And you have a daughter who's very active as well. So probably helps you chase her around when she's playing soccer and things like that.
yeah, she's now starting to drive herself this year. So
Oh my
but
gosh.
she's super busy, and she's an athlete, and I'm at her soccer games all the time, and
Yeah.
helping her with schoolwork and making dinners, and I'm now trying to just delegate a little bit more, I think. Especially at work, as you mentioned earlier, we have
Yeah.
such a great team here. So making sure that I'm delegating,
Hmm.
and then those 10 healthy, habits, the
Yes.
self-care. I encourage lots of folks, to just, it helps me stay grounded, energized, and effective in my role as mom and as, a leader.
So I used to run every morning. Well,
Oof.
run, walk.
Okay.
I mostly walk. But and especially when I was like training for the different things I was doing. But I got out of the habit, and when I got out of the habit, it was really hard for me to get back out into it. So I'm like super impressed by you right now that
Yeah,
you get yourself outside to do it because it feels so good when you get back in. Right? It's like you all of a sudden you're like, oh my gosh, I know why I do that every morning because it
yeah.
feels so
And,
good when I get done.
like even when I don't want to do it, if I don't want to go in the gym, like I'll go and just stretch
Yeah,
if I have those days. Just the that atomic habit of getting from my house to the gym. And most of the times, if I can get there, I'll
you'll
do
be
the
all
work.
in.
I'll do
Yeah,
the
you'll
workout.
do it.
Yeah, I'll do the workout. But yeah, I totally get you there.
I told myself, I was like, no, 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 like we got to get back into that because I that's the one missing piece for me right now. I've been doing really good on a few things, and then I'm like, I need to get back outside and do what I was doing before because it felt so, so good, and it's good for your brain.
It's good
So
for your brain. What's good
there
for
you
your
go.
heart is good for your brain.
Yes. Oh, that's a
Mhm.
good way to think of it too,
Yeah.
right? Because
Yeah.
they do work together.
Hmm.
Well, before we go, I want to talk about the walk briefly too. Um, it was very special to see that walk. So we were at Bolsa Chica just like a few weeks ago, and I had never seen the Alls walk before. I have been around like it before because we both have well, you work with Cindy and I've known Cindy for many years and she's brought me into many of her activities. This walk seemed very special. Did you break records with this? There was a lot of people there.
Yeah, the association has like 630 walks across the country that
Wow.
happen in the fall. And in my chapter in Orange County, we do three walks. And so you emceed our walk at Bolsa Chica at
Hmm.
Huntington. But collectively, with the three walks, we raised well over $1 million,
Oh
which
my
is, we
gosh.
raised a new record. And collectively, we had probably about 5,000 people in total at all, 3 walks. It is the number 3 walk run in all of Orange County, ranked by the Orange County Business Journal.
Nice.
Yeah, and it really is just this big support group and great feeling. You got choked up. I could
I
see
did. I
when you were on the
did.
stage. Yeah.
It was so special and it was so sweet because then you guys had the Fullerton flashers out. That
Yeah.
was the cutest thing I'd ever seen. It was a flash mob of senior citizens. I was not expecting it and it was awesome. It
They're
was so,
adorable.
they're adorable.
They're adorable.
Absolutely. But it was very special. And so I highly recommend if anybody wants to get involved, that's a great way to see what the Alzheimer's Association is about, learn about them, see what the community is doing, and then get out there and walk with them because it was very, very cool. Let's talk about that volunteering aspect very
Oh,
quickly. How can people get involved with
would love
Alzheimer's
for people to get
Association?
involved. I mean, we have high level volunteer opportunities in all of our chapters. So we need community educators. We need people to, support events like that didn't happen. The walk didn't happen just with the 11 staff members that I had. It literally took hundreds of volunteers, to pull that off. If people have a mission connection or maybe are in medical school, we use advocates, volunteer advocates, to share their story up in Sacramento or in Washington, D.C. So they come with us in the summer or the spring. So we're looking for people willing to share their story. And then I'm going to put this out there as well that we have a trial match program, and participating in a clinical trial is really important. We need people to volunteer and participate and explore opportunities to take part in clinical trials. And so we have a trial match program where people can learn, more about that. And it's not always like an invasive type of clinical trial or where they're using a drug. It could be like we were talking about the US Pointer study,
Mm-hmm.
where it has to do with risk reduction and, healthy habits. So they're all different kinds of clinical trials. And so that's another place. And connect with your local Alzheimer's Association chapter. You can go on to alz.org and find a chapter, that corresponds to the community that you're looking to volunteer in.
Fantastic. I highly recommend it. Volunteering changed my life. I will tell you that. Like I think about that all the time. I go, once I got involved, I was nonstop. And
Well,
it was
I've been
all
involved with,
good.
yeah, with you and like these past 2 organizations, and you're a powerhouse. So
Oh, thank you. And I'm raising powerhouses because my daughter got involved too. No.
yeah, she's incredible. She is incredible.
Thank you. No, it's fun. You know what? It didn't take much. It's like you do things and your kids see you doing things and then they want to do it. So it's all just like a really fun snowball effect. Very cool.
Well, it helps
Before
when
I
they have a great mom like you.
Thanks. Well, before we go, I always end with this last question. You've given us so much information, all very valuable, but what do you feel are the 3 big takeaways, 3 key takeaways that you really hope that anybody that was listening today will take with them, maybe write down and share with others?
Okay, number 1, early detection matters. So know those early warning signs, see a doctor, advocate for yourself. That's number 1.
Yes.
Number 2, we can take action right now, no matter where you are in life, like those healthy lifestyle habits, community engagement, volunteering. Every person can be part of the solution. And I would say number 3, that if you're living with a form of dementia or you're caring for somebody or you've lost somebody, I just want to say you're not alone. The association's network, resources, community, we're here, to support you every step of the way.
I love that. Oh, good takeaways, Deb. So good. Well, thank you so much for sharing your story, your journey, and also all of this valuable information about the Alzheimer's Association. Thank you for what you're doing in our community. I saw it firsthand. It's making a difference. People are happy to see that you are doing this. So we appreciate you. And I appreciate your time. Thank you.
I appreciate you too. I appreciate everything that you're doing and your family is doing in community. So thank you, Evelyn.
Oh, thanks, Deb. I'll see you soon.